Hey Super Mamas, it's Dr. Joy here and you are watching Delivering Joy MD TV. Welcome to Super Mama Sunday. Today, y'all, I am talking about a super important topic. It's so timely and it's one that you really need to have the real information about. Today, I'm going to be talking about the facts regarding the COVID-19 vaccine in pregnancy and during breastfeeding. So I want to make sure you guys have all the real facts instead of all of this crazy misinformation and rumors and the stuff that's being said in the streets about this vaccine, so that you can make an educated decision for you, for your baby, and for your family. So make sure you keep watching. All right, Super Mamas. So let's talk about the COVID-19 vaccine. So if you caught Well Woman Wednesday earlier this week, I'm gonna link it up here in the cards for you. But I was talking about how some of the misinformation got started about the COVID-19 vaccine and fertility. And so it's really been kind of a lot of misinformation floating around about the COVID-19 vaccine with regards to women becoming pregnant, with regards to women who are pregnant. So I think that we need to clear all that up. We need to get the facts out here so that people can make some real life decisions. I think that getting vaccinated, taking any sort of medical therapy, always needs to be a personal decision. But I also think that you need to have the facts. You need to understand the risks, the benefits, and the alternatives when it comes to making decisions about your health. So I want to just put the real facts out here so that you can then make a good decision for yourself and your family, because I believe, as you know, that it's your body, it's your baby, and it's your birth. So you want to be in a position to where you can make decisions that make sense for you. So I made this video here that I'm linking in the cards back last year at the height of the pandemic. And I made this video really to explain how the vaccine works, how it was developed so quickly, and about how the mRNA vaccines really work. I have pictures and all sorts of diagrams in this video, so make sure you check it out. I'm gonna briefly hit some of those topics here too, just to kind of give you an overall quick view of how these vaccines work, the ones that are available to you right now that you're probably thinking about or making decisions about. But the overall gist of both the Pfizer and Moderna vaccines, those are the mRNA vaccines, is that they are helping you become immune to the spike protein. The spike protein is a protein on the SARS-CoV-2 virus. And actually, the spike protein is how the SARS-CoV-2 virus attaches to the cells in our body and infects us with COVID-19. So the spike protein is an important part of the SARS-CoV-2 virus. So the Pfizer and the Moderna vaccines are what are called mRNA vaccines. And mRNA is like a recipe. And so these vaccines contain a recipe that's packaged in this little fatty envelope. And the envelope is in the vaccine itself. And then there's some water in it and there's some sugar in it. And that's really it. And that's what's injected into your arm. So when that gets injected into your arm, the envelope actually meets up with your muscle cells, and that fatty envelope dissolves and it allows the mRNA to get into your muscle cells. Like I said, the mRNA is a recipe. So it gives your muscle cells the recipe to make the spike protein. So your muscle cells begin making the spike protein and putting it out into your bloodstream. And as that spike protein flows around in your bloodstream, then your immune system starts to notice it. So that spike protein gets presented to your immune system. And then your immune system starts creating these proteins called antibodies. And that antibody is what actually gives you immunity to the spike protein. And you remember I said that the spike protein is how SARS-CoV-2 virus attaches to our cells and infects us with COVID-19. So that's the overall gist of it. All three of the vaccines actually are trying to get your immune system to produce antibodies against the spike protein. Now, the Johnson & Johnson vaccine works slightly different than the Pfizer and the Moderna vaccine. The Johnson & Johnson vaccine is what's called a vector vaccine, and a vector is a kind of a carrier. So instead of having the little fatty envelope with the mRNA in it, this is a vector. So this uses what we call a attenuator or a dead virus, and the spike protein recipe is attached to that. And then they actually introduce it to your body through that vector. So it's a little bit slightly different, but the whole overall goal of all three vaccines is to get your immune system to produce antibodies against the spike protein. So overall, that's the whole goal. And immunity is the whole goal. The great thing about producing antibodies when you're pregnant is that many times, most antibodies that we produce against viruses and bacteria are able to cross to our baby. So that means that you can actually pass immunity or protection to your baby while your baby is still in the womb, which is awesome. And that's really what we've been seeing as women have been getting vaccinated during their pregnancies. We've been seeing that babies have been born with antibodies against COVID-19, which is great. In addition, antibodies are also present in breast milk. So COVID-19 antibodies have been found in the breast milk of women who have been vaccinated. Now, a lot of people are very anxious. A lot of my patients have been real anxious. You know, my super mamas are coming in here and asking a lot of questions about this. There's been so much misinformation and just, I don't know, flat out lies going on out here. So it makes people very afraid about taking the vaccine. And so we've had a lot of conversation. I had a lot of conversation with my OB/GYN colleagues and gotten a chance to attend a lot of virtual webinars and read a lot of articles, because I too want to make sure that I'm advising the right things for the women who are asking me questions. So I think that what we have to recognize is that, yes, this is a new vaccine. It's still under the emergency use that was provided by the FDA, and it's still being studied. But what we know so far, from the evidence that we have so far, this vaccine is safe and effective for pregnant women and for women who are planning to become pregnant. I'm advising the women who come to me to get vaccinated. So I think that, you know, everyone must consider risk, benefits, and alternatives for themselves. But if we think about the risk of having COVID-19, especially during pregnancy, we have to consider that pregnant women are a higher risk group. And with the Delta variant, I have to just be real with y'all. You know, I try to be as professional as possible, but y'all, this Delta variant thing, it's scary. You know, at the height of the pandemic, the last couple of swells of the pandemic, you know, I saw lots of pregnant women who were infected with COVID-19. There were a few of them that were pretty sick, but this is the first time that I have personally seen folks who were on ventilators during their pregnancy. And you know, it is very, very concerning for me, because the Delta variant is so infective. Like, it's so infectious, I guess is the proper term. You can just barely be close to someone and you can pass this variant so quickly, and it kind of overwhelms the respiratory system. And think about it. in pregnancy, because of all of the hormones that you have floating around, it already kind of causes the respiratory system, like your nose and your airway, to be swollen a little bit and a little bit more what we call friable. So it's a little bit more irritated and inflamed. And so when you get infected with SARS-CoV-2 virus and have COVID-19 infection, it really causes havoc in the respiratory system of pregnant women. And as you get further along in the pregnancy, the uterus stretches up and gets larger, and it gives you less capacity to really take big, deep breaths. So the lungs don't expand as well as they do when you're not pregnant. So for pregnant women, this particular infection can be devastating. So, I really highly recommend that you look into the details of the COVID-19 vaccine, that you talk to your healthcare provider or your OB care team about it, and that you think about getting vaccinated, and that you talk to your family members and those who are in close proximity to you on a regular basis about getting vaccinated. Because if we look at the benefits, they appear to be pretty good. So if someone has been fully vaccinated, they seem to have protection from severe illness and death. And that is, obviously the goal here, right? And then also, when we think about the fact that you may be able to pass some protection to your baby, and that you may be able to also pass antibodies and protection through your breast milk. So that's a big deal. And I think that that's a huge benefit for moms and for babies and for families. In terms of the alternatives, we're all trying to navigate this whole COVID-19 world now. And I'm seeing so many people who are trying to do this socially distanced lifestyle, wear the mask, sanitize everything. It's really hard. It's hard. And there's been so much isolation, so much more anxiety, so much more depression, and, not really being able to have family around or be around other family. And there's so much fear. And so I just think that until we have enough folks vaccinated to where we can venture back out safely on a regular basis, it seems like, we keep seeing these surges of COVID, and we'll kind of go back down for a while, then we're back in a surge, and it's just mentally, emotionally, and physically exhausting. And so I just think that we've got to think about, how do we as a society really harness the power of science for our benefit. And I know that people have a lot of different conspiracy theories, but let's just be honest. We have seen science work, and we know science works. So I think that we have to consider the evidence and make some decisions. So, when I'm talking to you guys, I'm always going to give you some receipts. So make sure you check out the description box. I've got a lot of really great information in that description box. I have an OBGYN who talks about her reason for getting vaccinated when she was pregnant. And it's a really great article that she's written. And then I have a link to all the most current information about COVID-19, the COVID-19 vaccination, what you need to know as someone who is expecting a baby during the middle of a pandemic. So there are great resources there, and these are all trustworthy resources that I have researched and read myself, so you can trust these things. It's not just Dr. Google out here. And I want you to really think about it, consider it. I have been vaccinated. You can see my shot right here. And I also linked my blog down below, so you can see all of my symptoms that I had. I did a very detailed daily blog over the 21-day period that I had my shots in, and I did not grow another head. I didn't turn green. None of that happened. I did get a sore throat. I had sore arms. I, felt a little crappy for a few days, but so far I have not gotten COVID-19, knock on wood, and praise the Lord. But, I just want us to consider, especially those of us who are planning to birth in the midst of this pandemic. So talk to your family, talk to your healthcare provider, read up as much as you can, reliable information, and make the best decision for you and for your family. But if you want to know my honest opinion, my medical opinion, I think vaccination is the safest route to take, because you don't want to start one of the most wonderful times in your life with a serious illness like COVID-19. A friend of mine called me earlier this week and said, hey, can you help me with some resources for counseling and support? He had a patient who ended up on a ventilator during pregnancy, and unfortunately her husband died from COVID-19 while she was on the ventilator. So she literally came back and woke up to a nightmare. Like, I can't even imagine the trauma that this poor lady is going through. So this is such a serious illness, and this Delta variant seems to be attacking younger people and people who are healthy. So I just, this is my plea for you. If you have an opportunity to be vaccinated, please consider it, and consider it strongly, and really weigh the evidence and the risks and the benefits, because this is not a joke. It's not. And what we're seeing now is it's eye-opening for sure. I mean, I've never seen anything like it, and I've seen a lot, but I've never seen anything like it. So anywho, I know that a lot of people are concerned about, is this safe? And that's something that everyone is concerned about, especially the medical and scientific community. So if you do decide to get vaccinated, let me encourage you to sign up for the Be Safe. Be Safe is a smartphone-based registry. There's a Be Safe pregnancy registry. So if you do decide to get vaccinated, you can sign up for this registry, and the CDC is tracking. They want you to let them know right away if you have any sort of side effects or anything that occurs after your vaccinations, and they will continue to follow up with pregnant women for at least a year after their vaccinations. So far, there are over 5,000 people taking part in this Be Safe registry, and there have been 136,000 pregnant folks who reported being pregnant at the time of vaccination so far in the United States. So there are lots of ongoing studies and research, and so far what we know is that it appears that this vaccine is safe and effective in pregnant and breastfeeding women. So think about getting vaccinated. I hope that this video was useful for you. If so, give it a thumbs up. I would love to hear your questions, your comments, your concerns and thoughts about being vaccinated, because I think this is a conversation that needs to be had. So make sure you drop those in the comment section, and go ahead and subscribe so that you don't miss a single Super Mama Sunday episode. I'll catch you next Sunday, Super Mamas. Peace.